Hello dear friends, in this presentation I will show you a case of a complicated Pott Puffy tumour. This pathology first described by Dr. Pott in 1760 and it is a very rare clinical entity. Basically it's a serious complication of sinusitis. Patients present with symptoms of progressive sinusitis, headache, fever, and generally septic appearance, and swelling of the soft tissues anteriorly to the frontal sinus, very often with a visible and palpable lump, like in this case. This is the CT scan of the facial bones of this patient, 14-year-old girl, who presented with the typical symptoms of Pott Puffy tumour, and we will discuss the findings a little later. Pott Puffy tumour is osteomyelitis of the frontal bone associated with subperiosteal abscess causing swelling and edema over the forehead and scalp. This is a rare but severe complication of frontal sinusitis. Here I would like to mention that Pott Puffy tumour, it's a non-neoplastic complication, it's not a real tumour. Although it may affect patients of any age, the incidence is higher in adolescents. In order to understand the mechanism and the pathogenesis of this pathology, first we must understand the anatomy of the paranasal sinuses and the normal drainage of them. In this picture we can see the normal anatomy of the ethmoidal cells, and most importantly we must understand the osteometal complex or osteometal unit. One of the most important components of the osteometal complex is the ostium and duct of the maxillary sinus, as well as the middle nasal meatus, which is here. All these passages are communicate with each other, providing the normal drainage of the paranasal sinuses. In case of blockage of the osteometal complex, the normal drainage is compromised. So sinusitis may be developed, like in this case. Comparing the left with the right, we can see that on the right side the osteometal complex shows sufficient patency, and the right-sided paranasal sinuses are very well aerated, in contrary to the left side. As you can see, all the passages here are patent. The left-sided paranasal sinuses are fully opacified, as the drainage of the left maxillary sinus is compromised, resulting in opacification of the left frontal sinus as well. This condition causes stasis in the left frontal sinus, and infection starts to develop. As a result, there is demineralization of the bone, as you can see here. I will show you in sagittal views as well. here in sagittal views and in transverse plane. If you compare the left with the right side, you can see very easily the mineralization. There is also a very small cortical disruption in the inner table here, and here we can see the left frontal sinus totally opacified. There is also thickening of the soft tissues in the frontal region, as you can see, asymmetrical thickening. Unfortunately, as a complication of this condition, an intracranial abscess was found in this patient. This is a post-contrast CT scan of the head showing a bilocular intracranial subperiosteal abscess. Here in sagittal views, the abscess in the sagittal view. There is peripheral enhancement, as you can see, and central hypodensity. A Pott Puffy tumor is a very rare complication of sinusitis, but it shows a significant mortality rate of around 12%, so must be managed urgently. Dear friends, thank you for watching this interesting presentation. See you next time.